Welcome to the Security Nurse Podcast. Today I have Dr. Renee Thompson joining me. She is the CEO and founder of the Healthy Workforce Institute. They work with healthcare organizations to cultivate a professional workforce by addressing bullying and incivility. Renee has 30 years of clinical experience, nurse education, and nurse executive experience. She is an internationally recognized expert on creating healthy workforces in healthcare. Dr. Renee Thompson, thank you for joining me today.
Well, thank you for having me, Sarah. I love the fact that you started this podcast and it's all about keeping our health environment safe, like people who work in healthcare, keeping them safe. So really happy to be a guest on your show.
Thank you. And this podcast, we've looked a lot at like the technical side of healthcare security and some of the nursing side of security as well. And one of the reasons I really wanted to have you on today is because with your expertise in the bullying and incivility, this is a little bit of I feel like a tough subject because it really puts the spotlight on us as a profession and how we interact and treat each other and how that impacts ourselves, our patients, our organizations. But before we jump into all of that, I have a question that I love to ask every guest. What was that aha moment that you had that really led you to doing what it is that you do today?
Yeah, really great question. And it's actually one of my favorite questions to answer. I've been now, I think it's about 33 years as a nurse. And Sarah, I've done everything you can do as a nurse. I mean, bedside, I was an educator, I worked for a home care agency, I worked for a managed care company, I did case management, I was a frontline nurse manager, and then I ended up in a corporate role where I was responsible for the professional development of about 10,000 nurses. So I built a lot of programs and I spent a lot of time talking with nurses and student nurses. And you know what? All they wanted to talk about was how badly they were treated by the other nurses. And it reminded me of my own experiences. And all of a sudden, it was truly a moment when I thought it didn't matter where I worked or what role I had, even at the corporate executive level. I swear there was always someone who was trying to make my life difficult. And I thought, working in healthcare is hard enough without worrying about your coworkers making it harder. And we've been talking about bullying and incivility for a century, but what are we doing about it? And I decided in that moment that I was going to do something about it. And so I quit a really great job that I loved and started a company where I wanted to do something, take action to stop these behaviors because it's impacting everything. You talk about security. Well, there's personal security, but then there's even thinking about the negative impact bullying and incivility have on the very patients who we're serving. And so, yeah, that was my aha moment.
Yeah. And I think, we all have that story. There's something in our careers or our personal lives that put us on that trajectory. And so the fact that you were one of the people that wanted to step into that space really help address that. I think one takes a lot of courage and a lot of education and wisdom, and also just continued growth and recognizing what is going on. So I applaud you. I mean, I want to celebrate people on this podcast as well. So I really celebrate you for taking that initiative to start that company and really help addressing a lot of this because it is such a problem in healthcare. And so I think my next question is, we're saying that it's a problem. Well, let's define it. Let's talk about it. What does that bullying and incivility, like how do we define that in healthcare? What does that look like?
It's actually confusion over what it is and what it's not is a primary reason that it's not being addressed because we tend to label all bad behavior bullying. I had a coworker once, and this was pre-COVID, who reached out to me and she said her hospital was bullying her. I'm like, okay, what did your hospital do? Well, she refused to get a flu vaccine and she said they were making her wear a mask. And I said, are you the only one who is refusing a flu vaccine who they're making wear a mask? She's like, well, no. I'm like, well, that's not bullying. Okay. But like we tend to say, I didn't get the schedule that I wanted. My manager is bullying me. That's not bullying. So, to clarify, for a behavior to be considered bullying, there has to be a target, the behavior has to be harmful, and it has to be repeated over time. So, let's say in a crisis situation, sort of berate someone or you get testy with someone. That's not bullying. That's somebody having a bad moment. Still not okay. They need to apologize and all of that, but that's not bullying. So, what we're looking for is I'm fine with everyone else, but Sarah, there's just something about you that I target you and I
Mhm.
look to find fault and I give you the worst assignment or, whatever role I have. I find a way to zing you. The behavior has to be harmful, and sometimes harm, we look at harm as it relates to patients. If you're caring for patients, so if I refuse to help you, if I refuse to get report, if I withhold information from you to make you look bad in front of other people, there's potential harm to the patient. And again, it has to be repeated over time. It can't just be one time I'm having a bad day and I lash out at you. We actually don't see a lot of bullying in healthcare. We don't. I mean, it's
Interesting.
there. It's
Right.
there, but what we do see is an awful lot of incivility.
Mm.
So that's the low level, the gossip, the eye rolling, the mocking. It's most of what's out there right now. Again, there's not as much true bullying as most people think.
And I think that makes a lot of sense for even in my own personal experience. I mean, when we talk about this subject, it's hard for me to sometimes relate because I don't think I saw a lot of bullying as you define it, but the incivility, yes, absolutely.
Yeah.
The eye rolling and the gossiping and all of that. So if we kind of focus, obviously we need to focus on both, but if we want to focus on something that is a little bit more commonplace and rampant, the incivility, how do we address that? What are some strategies that you and your company and your colleagues are coming up with? And not even just coming up with, because I know that you really focus on evidence based. And we can even kind of define that too. Because I sometimes struggle with, well, what is evidence based? Who's going to be the guinea pig? That's the first one, to trial something to then be able to say it's evidence based. So maybe you could do that for me first and kind of define that.
So what we look at are, gosh, Sarah, there are numerous studies that show the negative impact disruptive behaviors have on fill in the blank. One study in particular, I use this a lot when I'm working with surgeons, and I work with a lot of surgeons. That study showed that orthopedic surgeons who are rude to the people in that OR end up with a 10% higher infection rate
Wow.
with their patients. Okay. And there's lots of reasons for that. So when we look at evidence based, it always starts with the studies. What are the studies showing? So we do a lot of research on our own. One, we just shared this recently when I was doing a keynote. This is over 2,000 data points. Asked frontline or team members, so nurses, support staff, about their leaders. And what we found was like 67% said that they don't believe that their leaders hold people accountable. I think it was 81% said their leaders are not addressing disruptive behaviors. So when we look at evidence, we look at first what's happening out there from a behavior impact perspective. Okay. So bottom line is we know it's an issue. This is not a nice to do. It's a must. Like you have to start addressing disruptive behaviors because of the negative impact that it has. And then we look at strategies and we look at, okay, if we implement these strategies, do they make a difference? Do they decrease the frequency of those behaviors? And we have a lot of programs that we do baseline surveys, and then we repeat that survey after we do interventions. So
Okay.
we have a department culture change initiative that it's a 1-year initiative. We work with the leaders and their teams. And what we're able to demonstrate is that by implementing our strategies, we can decrease the frequency of experienced and witnessed disruptive behaviors. And I have a validated tool for it, anywhere between 25 and 45%. So when
Wow.
we look at evidence, it's always starting with what's happening out there and why is this an important issue to address. We have numerous studies showing that. A study came out in April, AONL and the Joslin Insight study showed the number one factor impacting psychological safety is
Mhm.
incivility. So, like, we have to do something, but then it's what do you do? And that's where I don't see as many studies, as much research, because some of it is to your point. So we do a lot of that. I think that that's what makes us a little different. We're not just capturing prevalence, impact, we're capturing actions like interventions, and we have really positive outcomes.
That's fabulous, and that's part of, that's one of the things that I run into with suggestions on workplace violence mitigation
Mhm.
and some of those tools. It's like, well, what's evidence based? What actions are evidence based? And
Yeah.
it's hard to find the data that says, okay, well, if you do X, Y, and Z, this is your outcome. We all know it's happening, but what do we do
Yeah.
to address it? And so I think it's fantastic that you have that information and you're taking that extra step, because that's really where we're at in healthcare right now. We've known for decades that this is an issue, but we still haven't tried to quantify and qualify those steps and really put the data behind, okay, well, if you do X, Y, and Z, this is going to help your outcomes. So I think it's fantastic that you're doing that. And I
Thank you.
know you're welcome. And I know also, just to mention, and we'll put the link as well, you have your own podcast, which I have
Mhm.
watched episodes of, and you really address a lot of this. Each one of your episodes has actionable steps. You don't just talk about the data, you talk about the steps that you can take. And that's one of the reasons I really wanted to have you on today as well, because we need to start taking steps in
Yeah.
health to address a lot of this. What are some of the common mistakes that you
Mm.
see when leaders are trying to address this incivility and bullying in healthcare?
Well, I would say if I had to pick the number one mistake, and it might not sound like a mistake, but it is a mistake. The number one mistake, especially leaders make, is using silence as a strategy.
Mm,
They're not addressing disruptive behaviors. And I'm going to tell you, it's because I don't know how. I just talked to someone about a very common situation right now where you have a new leader who is in their 20s.
mhm.
They're new to leadership, and one of their staff nurses, who is incredibly competent, is twice their age, who is intimidating. You
Yeah.
know, this person may be condescending, like, "Who do you think you are, you young whippersnapper? You're not gonna tell me what to do," kind of a thing.
Mhm.
And that experienced nurse may be abrasive, may be a problem. Think about that 25-year-old new leader who, most human beings avoid confronting because it's painful, without giving that new leader the strategies, the tools, helping them to develop the skills to be able to confront anyone. That leader will do what's comfortable. They will do nothing. They will use silence as a strategy. And I always say it's not their fault. It's not. When I was a brand new manager,
Yeah.
I was a new manager. I didn't confront. I had no idea how to confront bad behavior. And I did what was comfortable. Like, actually, I did the opposite. I tried to be extra nice to people. And I thought, well, if I killed them with kindness, they would turn around. They did not. Okay. It backfired. So not a good strategy. But again, I really didn't know. And there was nothing in the organization to teach me. And one of the reasons that I really continue to do this work, and it's been almost 15 years now, is to help those leaders who are just like me. I had no idea how to address bad behavior. And so I just didn't. And it really had a negative impact on the culture, the retention, morale, and me. I burned out real quick. And so, yeah. So using silence as a strategy is a problem because a lot of them, that's what they do.
Yeah, I would agree with that. And one of the things that you have too, which somebody can get from your website, is the 30, like the scripts. It's
33
30 scripts. Yes.
my
Yes.
favorite.
I find that so helpful. Talk about that a little bit, and for viewers, and what that's all about.
Really struggle in the moment When someone says something rude to me, is condescending to me, is abrasive, I like, I don't know what to say. And then I go home and I ruminate over it. And the next day when I'm in the shower, I'm like, oh, I can think of all sorts of things that I should have said, I could have said, but by then it's too late. So I started writing scripts for myself. When I'm in this situation, I'm going to say this. When I'm in that situation, I'm going to say that. And I started sharing them, and people were like, oh my God, I love this. This was so helpful. So I have a YouTube video series called Coffee and Conversations about nurse bullying. And I don't record on that series any longer, but they're all still there. So I started sharing some of those scripts in that series, and people really resonated. And I'm like, I should put this together as a resource. And so I did. And by far, it is our most popular resource. I'll have to check the numbers, but we've had over 100,000 people download, probably more now, because it's 33 scripts that you can use when you do not know what to say in the moment. And so it's just a helpful tool. I have some people who like they have their favorites and they even transfer their favorites onto like an index card and they keep them in their pocket in case they're dealing with some badness. And, it just really helps you to know what to say ahead of time, plan it.
Yeah, I think that's definitely you're in good company there because I am definitely the same way. I'll be the one that'll ruminate a bit and think of like five other things I could have said in
Mhm.
that moment, but then to just like write them down and have them, right? And so be able to take those scripts and then make them your own and find like the key points in them because they're not gonna, I train self defense, I instruct self defense. You could come up with hundreds of self defense scenarios. I mean, it's the biggest thing is to remember you're having a human interaction, right? And it's not going to be the same every single time. There's going to be little nuances, but having those scripts, having that practice the same way we do with the self defense helps for that adaptation and that flexibility, which we know that as nurses, right? As innovators, as nurses, having to think on our feet, we learn what we learn in school, but then we realize, when we get to nursing, my nursing instructors always used to say there's the book way to do things and then there's the real world way to do things. And so I think that you have come up with a fabulous resource that really helps people be able to address kind of that those real world situations that they may find themselves in. I want to back up a little bit because you had mentioned accountability, and I would agree with that a major stress point for a lot of nurses is I don't see leadership holding that person accountable, right? Well, let's define that accountability because I think we're all going to filter accountability kind of through our own lens, our own traumas, our own things that we bring through the table. What does accountability? I mean, off note a little bit, but there's the five love languages. If you know what the five love languages are, right? There's also the five. Okay, so there's also the five apology languages. So people interpret yeah. So people interpret, they have an apology language as well. So for someone just saying sorry might be enough, but for another person saying sorry isn't enough, there's action involved, right? So let's think about that. What would accountability look like in healthcare and how can leaders help role model and show that? Because we also have, HR regulations and things where
Mhm.
we're restricted and limited. So, are there any strategies that you teach or can think of that can help with that?
Yeah, we can definitely unpack this. First of all, when the staff say, my leader doesn't hold anyone accountable, that's a perception. The leader may be doing everything they're supposed to do, the investigation, the documentation, going to HR. And sometimes they go to HR and they hit a brick wall
Mhm.
and HR won't let them do anything. And
Yeah.
I say that, I should do that in quotes, won't let them do anything. Okay. That is a situation. Other times, HR is telling me, hey, I have a leader who comes in, demands that I approve a termination, and there's no documentation. I've never heard about this employee, and their last 15 performance reviews meets or exceeds expectations. And they want me to approve a termination. Okay. So there's definitely a whole issue there, disconnect between leaders and HR. And one of the things that we focus a lot on is building that relationship, because there's no way you're going to create a healthy, respectful work culture if you're not including HR at the table. However, it's funny, it happened to me when I was a manager. I found out my staff were bad mouthing me, saying I never hold anybody accountable, like I said I would, blah, blah, blah.
Mhm.
They didn't know it. But for two of my employees, all I needed was one more incident and I could have fired them. But I couldn't walk around saying, hey, I just need one more thing.
Yeah.
One more thing. It's confidential. Like I've heard leaders, this didn't happen to me, but it happened to a colleague of mine who brought somebody into her office, gave a final written notice, corrective
Mhm.
action. And she said, this is confidential. I will not be sharing this. I do not want you talking about this. And she walks out of her office saying, I just got written up, a final written warning. And she's, huffing and puffing down the hallway. So the problem is you can be doing all the things you're supposed to be doing as a leader to quote unquote hold somebody accountable. But because it's confidential, you cannot go out and tell your people who complained, okay, that, hey, by the way, I just wrote them up. They're on corrective action. Like you can't do
Yeah.
that.
Right.
However, what you need to do as a leader is tell everybody on your team, look, when someone tells me they complain about one of their coworkers, serious incident, behavior, whatever that is, I take it very seriously. This is my process. I do an investigation. I do all these things. You're not going to know what the end result is, but know that I take this serious and I do have a process. Now, I do think leaders have a responsibility to circle back with that. Whoever complained and said, hey, I just wanted you to know I followed my process. I've closed the loop. It's confidential. I can't tell you the outcome, but it has been handled. So there's that whole piece, Sarah, but I'm going to tell you something. You know what's more important? It is what employees look for more than the manager coming to them saying, hey, I've handled it. If they complain about an employee's behavior, let's say this one nurse, every time she gets an assignment she doesn't like, she huffs and puffs, stomps down the hallway, has out, yells, blah, blah. They don't need to know from the manager that nurse has been written up. They'll
Mhm.
know the manager had a conversation, is holding them accountable when that nurse's behavior changes.
Changes. Yes.
They want to see the behavior change. If somebody comes in late all the time, they want to see them showing up all the time. If somebody is flipping out at the nurse's station anytime they get an assignment they don't like, they want to see that nurse recognizing that and stopping that. So it's seeing the behavior change that is the most powerful validation that person has been held accountable. Period.
I think that's absolutely kind of spot on, and that's why I brought up like those 5 apology
Yeah.
languages,
Yeah.
because that I think is what nurses and staff and everybody is wanting to see is the behavior change. And even when it comes to kind of some of that patient generated violence as well, holding patients accountable that can be accountable, right? We do recognize that we have dementia patients and some patients that are just, you can't do that, but, or even visitors, right? And holding them accountable. It's accountability means behavior changes.
Yes.
And I think that's kind of just full stop there. I think that's the best way to really define it and wrap it up.
Yeah. I agree.
Fantastic. Well, tell me a little bit about your books, because you have several books that you've written, and I would love to talk about them.
Yeah. Thank you for asking. So the first book I ever wrote, I think it was in 2012, it's called Do No Harm Applies to Nurses Too. Strategies to Protect and Bully Proof Yourself at Work. I wrote this for nurse to nurse bullying. Okay. And it was the topic in my doctoral program. I created a program to teach senior nursing students how to protect and bully proof themselves at work when they start their first job. A lot of it was based on confidence and self efficacy. And it was very successful, had great outcomes. I have to tell you, though, it's one of my funniest stories. I think it's funny.
Okay.
So I am a good writer. I'm not a great writer. And
Okay.
I wanted this to be a really great book. So I hired a writing coach.
Okay.
And she said, "Okay, before we meet, I want you to just give me a high level, like, overview, what do you want this book to be about?" And we met, uh, for coffee, and she said, "Oh, so you're writing a comedy. This is a comedic book." And I looked at her and I said, "Why would you think it was a comedy?" It's like, nurses bullying nurses. Like, that's not real, right? Because she wasn't a nurse. She didn't work in healthcare.
Right. Yeah.
She thought it was a comedy. And I said, "No, this is such a problem." Yeah,
Wow.
she thought it was gonna be a comedy. So that book came out, loved it. And then as I got into this work and my company started to grow and I went from it being me to an institute, I realized that the best way to help nurse to nurse bullying is to equip those leaders. So I shifted and I really focused on the leaders. And then, so my next book, well, I wrote two, like I wrote a book about burnout. I wrote a book about nurses as heroes. But the book that I wrote about nurse bullying, it was Enough, Eradicate Bullying and Incivility, Strategies for Frontline Leaders. And I wrote that in 2018. And
Okay.
so last year, I wanted to write another book. And I thought, what am I going to write? I already did one for the nurses, one for the leaders. What am I going to, focus on? And then I thought that book that I wrote for leaders was so good, but I wrote that book before the pandemic.
Yeah.
And let's just say a lot has changed. So I decided to do a second edition. And this is on video. Here it is. It's my second
Nice.
edition. And it's I have a bonus chapter. I've updated all the studies and I have more scripts, more practical tips. So I'm really excited. This was just published in October of 2025. So yeah. Yeah, I love
That
it. It's, the book I wish I would have had when I was a new leader. Mhm. Yeah.
No, that is amazing. And I'm frontline nursing. I've done charge nursing. I have not
Yeah. Me too.
moved into management or anything like that. Nor do I sit on the fence on whether I really want to actually move into management. I kind of like being in the middle and kind of that bridge builder. But one of the things I do recognize, because I did spend a little bit of time, I was a marketing and event director for a martial art studio in Colorado Springs. So I got a lot of experience. Yeah, I got a lot of experience, being over 300 volunteers when you're running a 2,000 person event and, for 3 or 4 days. And so I got my taste of that world. And so I can really appreciate, what leadership has to go through, what managers have to go through. And also, I'm that nurse that's been around for 20 years as well. And so, when I see the younger generation kind of coming in and moving into some of those management positions, and trying to think, how can we support them, because I know that they're not equipped. A lot of times in nursing and just in healthcare in general, you have one person that's doing 3 jobs, right? You have all these different hats on, and in my opinion as well, they're not trained and well equipped to move into a lot of these roles. A lot of these roles, they end up getting filled out of scarcity. And it's kind of, we need somebody to move into that and fill it real quick, right? So that we're at least able to keep check boxing,
Yes.
all, and it's a real problem. So the fact that you have created resources that can really help leaders and even frontline staff, I mean, I would encourage a bedside nurse to read this book as well, because it when we're all having kind of that leadership mindset, and when I say leadership mindset, I think, be the leader of yourself, right? If you're at that bedside, be the leader of yourself and take ownership of that. And so having that resource and having that book and being able to understand some of those concepts, I know have helped me as a bedside nurse. because it helps with patient education. How can I be the leader to help this patient take care of themselves so that we're not having those readmissions and they're having better outcomes when they go home? So the fact that you have created these resources, I absolutely love it. And I'm so thrilled and honored to be able to share it with everybody.
Well, thank you. And you bring up a really good point. The book isn't just only if you're a leader, you're a formal leader, because culture, addressing disruptive behaviors can't just be the leader's responsibility. It has to be everyone's responsibility. And even, coworker to coworker, in that book, the first one and now this one, it gives you how do you address that? What can you say? Sure, it's from a leader perspective, but it helps any human who's dealing with the bad behavior of another human how to address it. So it can't just be the leader's responsibility, it has to be everyone's.
Yeah, absolutely. Well, what are kind of next steps? Where do you see things kind of, I know maybe like forecasting to like 2026?
Well, just from a company perspective, we spent 2025 really building our infrastructure, making sure that so there are, let's see, 13 people on our team now. And so we have a core team, and then I have faculty and I have speakers. So we spent 2025 on infrastructure, project management tools, looking at SOPs and all that good stuff, and really getting clear on who does what. We're really looking at how do we take all of the content that we have. And honestly, Sarah, I don't know how this is going to come across. We have way too much content. We're
Mm,
always creating new content, but we have all that content. How are we delivering it?
mm-hmm.
So we're looking at different delivery models. So we have three, like I call them buckets, three ways that we work with people, organizations, healthcare. We speak. So I do a lot of keynote presentations. We do workshops. We do virtual. So lots of virtual webinars and virtual like half days. I would never do a virtual full day webinar. So we do a lot of speaking. We have our online academy. So we have a lot of online programs. But what I love about our programs is that it's not just, there you go, there's a course, go through it. We actually do live calls every month with the people who are enrolled in our courses. It's the conversations that we have about what they're learning. And then we do consulting. We do a lot of consulting. So we actually go into an organization and we spend a year or two really working on their culture. And so we do a lot of that work. In 2026, we're looking at how do we kind of repackage it and deliver it in a way that people want to have it right now, because it's the micro, learning nuggets. They don't want, like I said, a full day workshop. They want to have their content delivered in a way that's easy for them to access it and it's bite sized. So we're looking right now, we're actually working with someone to take a look at how we deliver all of our content and actually make it more conversational so that people have space and they can hop on with us and get the help that they need real time.
That's fantastic. I think that's and especially with like AI, right? So
Yeah.
AI coming into healthcare and well, just not just healthcare, just in general now, right?
Mhm.
Um, how are we going to really kind of deliver all of this content and our education? And it's changing. I really do think it's changing significantly on how that's being delivered. So kudos to you on addressing that.
Thank you. And we use AI. It's funny, we dip our toe in the water. So here's an example. I will write something and then I will put it into GPT and I'll say, make it better. Because remember, I said I'm a good writer. I'm not a great writer.
Uh-huh.
I'll put I'll I'll put in like 3 or 4 articles that I've already written, and I'll ask GPT to like slice and dice it and give me a couple of scripts that I can do a quick little video for it. So I love it for that. But I am shocked that I failed to mention probably something that I'm most excited about going into 2026. And every single day I'm working on it. So it's probably I'm numb to it. But I mentioned that we do consulting. I developed a system. It's called the Department Culture Change Initiative, where we go in, we work usually with the whole service line. So surgical services, maternal child health, and we implement this system. It's based on a framework that I developed. It's the Healthy Workforce Framework. And it's 3 pillars: strengthening organizations, equipping leaders, empowering teams. And
Okay.
we're working on our white paper and toolkit that's
Okay.
going to be published in January with lots of additional tools and you'll see those 33 scripts in there too. So
Fantastic.
I have, it's one of those things that, yeah, it's my framework. I use it. But I thought, wait a minute, this framework works. Why don't I have it out there for people to utilize? So that's I said, we have way too much content scattered, but this framework kind of pulls all of that together. So really excited about that.
That is fantastic. So you're going to have that available then on your website to pack. You have it kind of as a package to be able to do that
Yeah,
framework.
free. It's a framework, free.
Fantastic. That is amazing. To shift a little bit, I want to have a little bit of fun here. I have an interesting, I think it's interesting, but shifting gears a little, what is kind of the thing that you've been enjoying about podcasting and what are some of the things that you're learning and excited about doing the podcasting? Because like I said, your episodes that you put out there are just phenomenal and have so much good information on them.
Thank you. I will say that I didn't feel that way at the beginning. Okay. I speak. I'm always in front of audiences, but then, you have a mic and you're interviewing someone and I'm like, I want to say the right things and do the right things. And I'm the host. So I'm wearing a different hat when I'm the host than I am when I'm a guest. When I'm a guest, I just talk. Okay? I mean,
Mhm.
I'm thoughtful. I'm thinking through what I'm going to say. But when you're the host, you have to be a little bit more strategic. I'm watching the clock. I'm doing all these other things. And it's funny because sometimes I'll record an episode and I'm like, I don't know if did I ask the right questions? Did I respond the right way? I'm not sure how good it is. And then I always listen to it when it comes out. I'm like, oh my God, that was so good. That was a great conversation. But I will tell you my favorite thing is I am interviewing people who I have learned so much from. And that was one of the reasons that I wanted to start a podcast, was to get the message out there to as many people as I could. Like, you don't have to suffer in silence, that you can do something about bullying and incivility. But it was also to learn from other people what they're doing. Because I know I'm not the only one who's doing great things out there related to culture work. And I'm always asked the question, why coffee? So I told you my YouTube video series, Coffee and Conversations about nurse bullying. I have a very, very, I guess, famous coffee story. And it's actually on my website on my keynote page about slurping my coffee. And then I called my podcast Coffee Break. And it's because when I was a little girl, when it was after dinner, if my mom put the coffee, like the percolator, on the stove after dinner to make coffee, that meant either one of her girlfriends, her neighbors, or one of her sisters was coming over and they were going to sit in the kitchen, drink coffee, and have a chit chat. And I remember thinking, when I get older, I want to have coffee and have my girlfriends over and have a chit chat. So coffee for me is connection. It's
Mhm.
conversations. And the podcast gave me that forum to be able, like, I will have a cup of coffee unless it's in the afternoon. Then I have to have decaf tea because I've become a slow metabolizer of coffee. It's very sad. So I can't have coffee after 12. When I was young, I'd drink coffee at 8, 9 o'clock at night, go right to sleep. Yeah.
No, I those days are catching up with me as well. I've been having similar experiences lately.
Yes, I love coffee, and yeah, even decaf, like after a certain time, it'll bother
Mhm.
me. So, but I always have coffee, and I always truly feel like I am sitting in a coffee shop, having a chat with someone, learning something from them, and having a laugh or two. And yeah, so Love doing the podcast. Never thought that it would be something that I enjoyed as much as I do.
That's fantastic. That was kind of my motivation for the same
Yeah.
thing. It's having those conversations with people that have knowledge that I don't have, to be
Mhm.
able to put that out there and bridge that, because I think we can get isolated in healthcare, and we work in silos. We
Mhm.
still work in so many silos in healthcare. And that was another one of my motivations with this podcast of like, let's really start breaking down those silos and seeing how interconnected this really all is, and how we really have to look at it big. We have to look at it macro in order to kind of fix the micro.
Definitely.
And so that was definitely my motivation with this podcast and being able to have people on. I mean, your 33 scripts might be for nursing leaders, but there's a security director that's going to watch this podcast
Mhm.
that can absolutely download those scripts and then tailor it to however he or she needs to for their security director role, which I highly recommend. If you're watching this right now, you're a
Yes.
security director, go download it. You can use it. Trust me, it's adaptable.
Yes.
And so, being able to do that with the podcast has been amazing, and the feedback, and I just feel so blessed, honestly.
Yes. No, you're right. And to have that sense of gratitude for people willing to give, this is how I look at it. They're busy and they're willing to give me their time. It's a gift, and share their wisdom without paying them. Like, it's free. It's like I don't pay anyone. I don't get paid when I'm a guest on a podcast. It's because they, and this is how I feel, sending that message out there, saying something that somebody's listening who needs to hear what you're talking about. Because I think security. So my husband's law enforcement his whole life.
Okay.
So he was a military police officer. He was a detective for the Pittsburgh police many years ago. And I'm going to tell you, Sarah, I learned a lot about that behavior
Mhm.
from my husband and the whole keeping the environment safe. My friends love it when my husband travels with us because he's always a couple of steps behind us,
Mhm.
always on surveillance. Hey, like we're always like, we know my husband's name is Ashley. Ashley's always on surveillance, and sometimes he'll walk up to me and he'll say, "Walk fast, move to the left, move to the right." I'm like, huh? Huh? I just do what he tells me to do. He's like, okay, because there was someone, blah blah blah. Like, I didn't notice anything.
Huh?
So I love that you provide this forum for security directors, for nurses, for anyone who is really trying to make sure that we maintain a safe environment for the people who work in healthcare or beyond,
Yeah, absolutely. And I think now I'm even more like this was a clandestine conversation, because I had no idea
right?
about your husband, and that you had that background as well. So it seems even more, meant to be today to have you on.
Well, thank you.
Any last thoughts? We're going to wrap things up. Are there any last thoughts that you want to leave viewers with today?
Well, I will say that, you know, bullying and incivility happen because they can. And we've been ignoring it, using silence as a strategy for years. And people now say, well, it's just a reflection of society. Society is getting angrier and meaner. And I my pushback is, well, aren't we part of society too? Are we okay with that? You don't have to necessarily stand up to a bully. Okay, someone who, you're so afraid may retaliate against you. But I always just say, do something. Say
Mhm.
something to someone. It might be saying something to the person who just got berated. Say, hey, I saw what happened. Are you okay? That wasn't all right. Or telling a manager or a leader or someone. Or you might say something to, the person being disruptive. But we have to all stop using silence as a strategy if we're ever going to cultivate a safe, healthy, respectful work culture. So say something to someone, do something.
I think that's absolutely perfect to end on that. Last question though, one last
Mhm.
question. I'll put all your links in the show notes, but just what is the best way that you would like people to reach out to you to get in touch?
Well, I'm on LinkedIn every single day of my life. So you can absolutely hop on LinkedIn, ask to connect with me, and let me know that you heard me on Sarah's podcast. and go to my website. I have so many resources on my website. I do a blog every month. We have video on the website. We just have so many free resources on the website. You can get my book on the website and see what else we have on our website. But yeah, so either LinkedIn or my website would be great.
Perfect. All right. Well, thank you so much for being on the show today. It was a pleasure. And
You're welcome.
I'm so glad we got to have this conversation.
I am too, Sarah. Thank you.